to the doctors that they should be judicious when they are prescribing antibiotics. IMA is not against anyopathy. We rather respect all the pathies. We respect our Indian system of medicine. The only point is we are against the cross-pathy. Definitely they have little bit lesser grey matter than those who are going to government medical college. If the violence is not acceptable during COVID on the healthcare worker and doctors, then how is it acceptable during normal life?
Welcome to our show, Health Dialogue. I'm Anshima. Today we have the privilege of being joined by an extraordinary guest, Dr. Sharad Agarwal, National President of Indian Medical Association. He is MBBS, MD and MHA. He is the council member of the World Medical Association. He is the head of the IMA ICB UNESCO Bioethics. He is the ex officio member of the National Board of Examination, and he is the board member of the NABH. Let's start with a very basic question for all our audience. What exactly is the Indian Medical Association and what does this body do?
See, Indian Medical Association is the largest association of the doctors, modern medicine. We have 4 lakh members in our association and we have 1750 branches across the country. You must be glad to know that we have completed almost 95 years and in 2028 we are celebrating our centenary year. So you can understand the magnitude of an association which is almost 100-year-old and having its branches across the country, 1750 branches and 4 lakh direct members. And other than that, we have more than 2 lakhs members who are associated like the Medical Student Network through Junior Doctor Network. So that is what Indian Medical Association is. And Indian Medical Association is doing the public society service. Our aims are mainly, we have 3 aims. Number 1, for the upliftment of the society. Number 2, for the upgradation of the medical advancement of the doctor through continuous medical education program. And third is to maintaining the dignity of the profession. In the first aim objective, which is our major aim for the upliftment of society, we are running more than 70 projects for the society. We are running through our branches, through our members. We have constituted a different committee for a specific disease, and mainly we are working on the preventive part of the disease so that we can help the society. You see the contribution of IMA and the doctors during COVID. When there were nobody in the road, even the direct relatives of the patient, the wife of the husband or the husband of the wife, they were not touching and not going close to the patient. That time only and only the members of Indian Medical Association, doctors of India and the healthcare worker of the India, they sacrifices their life, they put their life on the risk to treat the patient for the society. And that is why our COVID management, it was appraised by entire world. And under the dynamic leadership of our beloved Prime Minister Shri Narendra Modi ji, Indian Medical Association led the campaign of COVID management. And during this, we have lost 2,000 doctors. We have lost 2,000 lives. We have lost very young doctors. You know that doctors working in ICU, they are very young. They were 30-year-old, 32-year-old. They lost their life. We try to help because we don't have the fund. We don't get any aid. Whatever fund we have the collection from our members only. And we try to create that fund, COVID Martyr Fund, through which we have supported almost 32 families by giving them 10 lakh rupees. And I don't think this 10 lakh rupees is going to help them entire life. But it is a gesture from the Indian Medical Association. And if you can make this point to the government, that they should also contribute to the doctors and the healthcare worker who lost their life during COVID.
What are some of the key challenges faced by Indian Medical Association?
See, the challenges is that number 1 is the violence. Violence against doctors and the healthcare workers and health establishment. I don't think any country in the world is having that policy and that any kind of violence on the doctor is acceptable. It is only and only in India that it is happening, and no government is ready to take cognizance action. You tell me one thing. During COVID, by an ordinance, Indian government bring an ordinance that any kind of violence on the healthcare worker and the doctor is a punishable offense. But why can't they extend that in the normal life? If the violence is not acceptable during COVID on the healthcare worker and doctors, then how is it acceptable during normal life? Why government is reluctant to bringing a center law against the violence? And it is not demand, it is request, it is need of the hour. You understand? How can a doctor take a decision, work in a critical situation, under stress and under threat? You realize this thing, the nation is not realizing the problem. If this violence keep on going on, no doctor in future, no good doctor will take a serious patient, because they will be threatened, they will be afraid of the result. As you know that our job is to put our best, but result is not in our hand. There is a term called destiny. जिंदगी और मौत ऊपर वाले के हाथ में है, हम अपने एफर्ट्स कर सकते हैं, but God forbid, if this situation, its scenario keep on going on, there will be a day when the good doctors, good hospital, they will reluctant to take the serious patient in a critical care. They will be reluctant to take the serious surgery cases because of the afraid, because of the fear that God forbid if something went wrong, then there will be a goons who will attack the hospital, they will attack the doctors, then who will put their life on the threat? So this should be stopped immediately, and doctors are dealing with this sensitive life. We don't have second chance. We have to perform in a single attempt. And you tell me any profession who works 24/7, 365 days with the same intensity, same sincerity. So this is only the only healthcare profession who works like this, and if they will force to work under stress, then there will be a very, very disastrous situation in future. So that is a very important concern of Indian Medical Association. Government should take a cognizance. The second most important issue is the integrated medicine. We heard about some notification and some action that government is planning to starting some integrated type of approach during a undergraduate level. So that will again a disastrous one. See, the present medical education system of Indian government, they brought laurels to them. Our doctors are treated as the best doctor in the world. We are being trained by this existing system. So why you want to change that system? Lot of medical tourism, lot of money is coming to India. If you see for last 20 years or 10 years, the medical tourism has increased like manifold, because the doctors of India, they consider is the best. Our treatment, our outcome is considered is the best in the world. We are at par with the international standards, and the cost wise, we are tenfold down than in comparison to the outer world. Even the Southeast Asia countries, India is the preferred destination for the medical treatment. So we should not destroy that medical system, the education system, which already brought lot of laurel. Yes, I agree. The change is the need of life. You can modify something, but you should not change the entire system of medical education. We want that government should do integrative medicine after the education. Once a doctor has been trained and qualified in any pathy, after that there can be a holistic approach, because all the pathies are different, all the procedure, all the basics are different. It will be a disaster if they mix all these things. And the third important point is Indian medical service cadre. We are demanding for years, like IAS, like engineering services, government should start Indian medical service cadre. Every politician say that doctors don't want to go to the village. No, this is wrong statement. We are ready, but you should create a system. You should create a system so that there is a uniformity of the working atmosphere, the working condition, their perks, their right, their responsibility should be uniform, like in the IAS, like in the centralized engineering services, railway services. Why can't you create a IMS? You should create IMS. Good people will come. Good people will be attracted. Yes, the government has this standardized system. Then everybody will join. National exit test. That is against a, we would say government should do a brainstorming and make IMA the partner. We will give them the right, advice. We can brainstorm on the positive and the negative of the next. So there are a lot of fallacies in the next itself, and it is not right. No profession has these kind of tests. Why on the medical? In a country where we say the doctors are less, in a country where we want to improve our key performance indicator, doctor and the patient ratio, doctor and the citizen ratio, not the patient ratio. So why you are putting lot of restriction? See what will happen. You are constructing lot of private medical college now. You have seen that in last 2 years, almost 200 new medical colleges has been started, and most of them are the private medical colleges. What NMC is doing? NMCs failed to maintain the medical education standard. Even the college don't have the faculty. What will happen with those poor students who will follow this costly education? After this NMC, the cost of education has increased 20-fold. Now the cost has come around 1 crore rupees for a private doing undergraduate from private medical college. So what will happen with those students? Because definitely those students who are not able to crack in the government medical college, definitely they have little bit lesser gray matter than those who are going to government medical college. When these students will come out, and what is happening? They all are not belong from the rich family. Many of them are taking the bank loan. Many of them are selling their land. Many of them are selling their house, taking loans, and then admitting their kids into the private medical college. What will happen when they come after the passing out of those ill-standard private medical colleges, which NMC is not controlling? What will happen with those students and those families? Where will they go after next?
We found the IMA taking a stand against Ayush.
IMA is not against anyopathy.
Yeah.
So please correct this statement, and I am saying it with very responsibility. IMA is not against anyopathy. We rather respect all the pathies. We respect our Indian system of medicine. The only point is we are against the cross-pathy. And it is not we against. It is as per the Constitution of India. There are a lot of judgment of the court, Supreme Court and High Court, where the doctor has been penalized for treating something for which he was not trained, even in the same pathy, modern medicine. Then how can it is acceptable when a person of a different pathy, who at all not underwent the training of the modern medicine and writing the modern medicine medicines? So we are against of the cross-pathy. We are not against any pathy, number one. We want that, modern medicine is the evidence-based medicine. We have the journal, we have researches. Whatever we say, you can go and search. There are journals, there are researches. We don't say on just motherhood tongue ke ye to aise hi hota hai. Aisa nahi hai. Every medicine went through a proper research. Then it got the approval. That is what we want, that government should improve the Ayush. Government should open up the more and more research institute, as government has started. That is a welcome move. Recently, I heard that 4-5 central institute of Ayush has been opened. One is in Ghaziabad.
Yeah.
That is a good move. But for that, government's intention should be right, and execution. Because government or the minister, they can think, but execution at the level of administration, that they have to check. Because their intention is good, government intention is good, minister intention is good, prime minister intention is good, but the execution they are not able to control. Where the role of IMA comes? If they take our advantage, our experience of which is more than 100-year experience, we can give the right advices to building a healthy nation. We want government should start and promote lot of research in Ayush. We are ready to support if any support is required.
IMA's call to the doctors about being mindful while prescribing antibiotics is very apt. But in a country like India, where you have lesser doctor penetration, do you think it is possible to control antibiotic uses?
Antimicrobial resistance is a global problem. It is not an Indian problem.
Okay.
And there is a speculation that in coming year there will be more than 5 million deaths by AMR. Right? It is not an Indian problem. It is a universal problem. That is why we taken up a proactive step, and we release that our press release advice to the doctors that they should be judicious when they are prescribing antibiotics. So we want to take we are not waiting for someone to say us that you do this.
Yeah, right.
We understand our responsibility towards the nation, and in spite of so much of challenges and neglected, we are doing our job. So that is what we have to do, and see, someone somewhere has to take the start ना.
Yeah, right.
आप ये सोच के बैठे रहोगे कि इतना बड़ा कंट्री है नहीं कर पाएंगे, तब तो कुछ भी नहीं हो पाएगा. अगर हमारे if our freedom fighters has thought like this, तो इतना बड़ा कंट्री है, अंग्रेजों से कैसे लड़ेंगे, तब तो हम आज़ाद ही नहीं हो पाते ना. So that is the step IMA is taking. IMA continuously advising our 4 lakh members through Zoom meeting also. So that is why I told that IMA is running more than 70 projects for the society, and that release is for the society, but in an internal system we keep on organizing regular Zoom meeting where we invited doctors across India and telling them what should do, what should not do.
Technology is shaping up the healthcare ecosystem in India. So while on one hand it facilitates reach, on the other hand it raises questions about data privacy also. So how will you see the matter?
See, technology will come. You cannot stop.
Yeah, right.
So in today's era, technology is improving and coming so fast. You cannot be live without that. Only thing, we have to train ourselves, and we have to accommodate that technology.
Okay.
So that we have to do, and that is what I said, that our second aim is to upgrade ourselves for the newer advancements through CME's program.
Yeah.
So that is our aim. We are doing that. And technology is one part. Data secrecy is a different part.
Okay.
Technology and data secrecy is not the synonymous. Data secrecy is the digitalization. So we have come through the news, lot of news in the social media or the media, that some data has been leaked by some agency. So if that has been plugged in, so no problem. What is the problem of data sharing? If it helps the system, we are open. We are not like a opposite party that we are going to oppose on each and everything. So it is a good thing. We maintain ourselves, and we have to be abreast with the newer advancement. And it is that effect of technology that India is now able to treat the serious to serious cancer patients, for which 10 years before you even cannot think of. We were only dependent upon the Cobalt 60 machine, which is an outdated machine right now for the radiation. Now you have best to best technology. So technology is always welcome.
India is trying his hand in robotic surgery. So what do you think about it?
Definitely good, but for that a training is required.
Yeah.
Whoever is bringing, because they are very costly equipments, so whenever they've been bringing to the hospital, lot of training has been given to the doctors. That is good. At least you are having that modality of treatment which 20 years before even you cannot think of in India.
So do you think that there is a need of creating awareness?
Awareness is there. The only thing is the cost factor.
Yeah.
In India, cost is a very important factor. And see, if you want to have that kind of specialized and specific and very sophisticated treatment, it requires some cost.
Yeah.
So you cannot then come tomorrow. You come and ask that doctors are charging. Doctors are not charging. It is the hospitals who are bringing so costly. The Linex machine comes in 20 to 24 crore rupees,
Yeah, right.
and the maintenance required 50 lakh, 35 lakhs per year. So from where the cost will come?
Yeah.
So that has to be bear by the patient or the government.
In one of the studies, India came out to be a country producing maximum health misinformation during COVID. So why do you think this happened?
I don't aware of that study where it comes that India has the maximum misinformation. COVID was a new disease for the world, and nobody knew about the disease. Nobody knew that the behavior of the virus. Nobody knew the behavior of the progression of the disease. So everybody, every day there were new changes depending upon the patient behavior, depending upon the treatment behavior on the patient. So suppose today someone is saying that this is the treatment, this is the regime. After 7 days, that regime has been changed, because within 7 days we found that okay, this is not good, this is doing better. So you can tag retrospectively that 7 days before whatever incident was misinformation.
Yeah, right.
That was not misinformation. That was ever evolving, very fast evolving, adaptation. If you go to the social media, there are 100 or 1,000 kind of things are there.
Yeah, right.
It is up to you what you want to read. So I think we should have some self-regulation on us. Then things are there. See, you go on the road, you found the roadside vendor, chaat pakodi and all, and that is in a shop also, that in the hotel also. It depends on you where you want to take, what you want to take, right? So it has to be self-regulated thing.
How does IMA perceive the effectiveness and the significance of the initiatives such as Aao Gaon Chale, TB control programs, and Save Girl Child campaigns, which have had a profound impact in the society?
Yeah, see, Aao Gaon Chale is a project started by our visionary leader, Shri Dr. Ketan Desai sir. In 2004, he launched this project and he gave that term, which is very close to the doctors, Aao Gaon Chale.
Yeah, right.
And during the COVID, it went back seat, because of, you can understand, our focus was on COVID management. But now this year I have relaunched this with the blessing of Dr. Ketan Desai. And in this project, we have asked our 1750 branches to adopt at least minimum one village. They can adopt more than one village, but our requirement is at least one village by each and every branch. And we have requested them to go in the villages and perform a regular medical activities, mainly on the prevention. Plus, do some disease specific, test also. Like they can do the anemia detection, they can do the iron deficiency, they can assess the vaccination profile of that village, and they can also aware the village do's and don't of a seasonal diseases. So that is what Aao Gaon Chale is a very effective, and till now more than 1100 branches has been adopted the village, and on 25th June we are relaunching it in a big bang through our all branches across country. So Aao Gaon Chale is very, very good project. TV control, you see that when government was adopting a DOT strategy, even the government doctors were not trained. Again, it was the Indian Medical Association who took initiative, and we partnered with the government, and we trained, sensitized our 3 lakh doctors through more than 2000 workshops, and we sensitized them how to do this DOT strategy, how to report the TB cases.
Yeah, right.
And because of the IMA effort, when government initially was thinking to eliminate TB by 2030, now they are thinking to eliminate in 2025. Save Girl Child. Save Girl Child term coined by IMA 20 years back. Beti Bachao used to be logo on our journal, on our letterhead 20 years back. So, as I mentioned in my starting, that more than 70 projects IMA is handling for the society. You are forgetting one thing, HIV AIDS.
Yeah.
In the late 90s, when the HIV/AIDS came, and even the doctors were afraid to touch the patient, again Indian Medical Association taken the initiative, and through we joined with the Clinton Foundation, and we sensitized. That time our membership was around 2.5 lakh. We sensitized 2.5 lakh doctors through thousands of workshop, and that is the result. And we are here now. So IMA and the polio eradication was happened because of the effort of IMA.
Thank you so much. Thank you so much, Dr. Saab.
Thank you, ji. My
It was a
pleasure.
pleasure having you with us.
My pleasure.